Hi, Dr. Edwin Williams here, Fireside Chat. I'm a facelift specialist that has a lot of experience with skin. For 25 years we've been doing skin rejuvenation, so I get a lot of questions on the non-surgical aspect of our practice from our patients. And one of them is, what is the difference between microneedling versus microdermabrasion? Okay, so let's talk about microdermabrasion. What microdermabrasion does, it kind of sandblasts the skin, and it treats the surface of the skin and ablates or removes the dead exfoliated type cells physically, not like a chemically, but physically removes those dead cells. So that's what microdermabrasion does. It doesn't get deep in the skin, so the results are not long lasting. In fact, after a week or two, anyone who's had microdermabrasion will tell you initially the skin feels nice and smooth. After a week or two, those effects are no longer there. So what is microneedling? Microneedling is we put a topical anesthesia on, so it doesn't hurt, but these very, very fine little needles go up and down in the skin. What they do is they stimulate the production of new skin cells. Okay, so it's different. It actually stimulates deep. It reaches deep below the surface of the skin, making little microscopic punctures that targets collagen and elastin and causes the fibroblast to make a little bit more of that, which is good for your skin, by the way. It tightens skin, it reduces some of the fine lines, and is very helpful in multiple treatments on shallow acne scarring. It reduces the pore size, stretches is good for stretch marks, and really what it comes down to, think of it as collagen induction therapy. That's really where the difference between what microdermabrasion does and microneedling. Who's a good candidate for microdermabrasion? Basically anyone who wants to improve the condition of their skin and wants the dull sheen or dry skin to look better. Good candidates for microdermabrasion, anyone who really has skin laxity, stretch marks, acne scars, large pores, and uneven pigmentation. And that is really the ideal candidate for the microneedling. Recovery time microdermabrasion, really no downtime, and is suitable for all skin types. Microneedling is basically has a little bit, I've had it before and gone to see patients the next day, has a little bit more of a recovery, 2 to 24 hours of redness, and is suitable for all skin types. What are the cost treatments? Typically, microdermabrasion is performed in the salon or spa and is somewhere between $140 to $175 a treatment. Microneedling is a little bit more of a medical procedure. It is performed in the here we have physician's office, performed in the physician's office, and is performed by registered nurses or healthcare professionals. It's typically about $300 for the face. Additional packages for the hand and other areas are about $100 a piece. And a package of 4 is somewhere around $1,000, called the Rejuva Center, and they'll give you the information. Additional purchase of stem cells, I think it's about $195, and that actually helps stimulate more collagen. And typically we space those treatments out 4 to 6 weeks with microneedling. So hope that answers your questions on what is the difference between microneedling and microdermabrasion. I appreciate you watching. Thanks.